A 26-year-old man comes to the office for follow-up related to painless progressive visual loss in the right eye. Recent ophthalmological evaluation revealed macular edema due to 2 retinal lesions consistent with capillary hemangioblastoma. He underwent laser photocoagulation treatment, and the vision in his right eye has improved. The patient has no other medical conditions. His father died from a cerebral hemorrhage at the age of 52. MRI of the brain with gadolinium reveals 2 small cystic enhancing nodules in the cerebellum. Renal ultrasonography reveals multiple cysts in both kidneys. The question is, which of the following is the most likely diagnosis? The choices are A, autosomal dominant polycystic kidney disease, B, autosomal recessive polycystic kidney disease, C, Li-Fraumeni Syndrome, D, Neurofibromatosis Type 2, E, von Hippel-Lindau Disease. If you know the correct choice, you are welcome to subscribe and join our community of smart doctors. Otherwise, keep learning. The correct choice is E, which is von Hippel-Lindau disease. This patient has evidence of von Hippel-Lindau disease, an autosomal dominant disorder that results in benign and malignant multi-organ tumors. The most common tumors associated with VHL are hemangioblastomas of the central nervous system, particularly in the cerebellum with a classic cystic nodular radiographic appearance and retina. Although the tumors are non-invasive, symptoms occur due to hemorrhage or compression of surrounding tissues. Bleeding from retinal tumors can lead to retinal exudates and impaired vision, or if untreated, retinal detachment with vision loss. Acute hemorrhage in a brain tumor can result in herniation and death, as likely occurred in this patient's father. Malignant manifestations include renal cell carcinoma, which occurs in upward of 70% of patients by age 60. RCCs are of the clear cell subtype and typically bilateral. They are often preceded by the formation of multiple renal cysts, which are considered a pre-malignant condition. Pheochromocytomas also occur with increased frequency and are characterized by paroxysms of hypertension, tachycardia, and diaphoresis. Less common manifestations include vascular tumors of the endolymphatic sac in the ear and pancreatic disease like cysts and neuroendocrine tumors. Genetic testing for germline VHL mutations is key to diagnosis. Management requires frequent tumor surveillance beginning in infancy or early childhood. Let me explain why your choice is incorrect. Choice A, autosomal dominant polycystic kidney disease, also manifests as CNS and renal disease. However, the CNS disease is largely due to aneurysms, which would not appear as cystic nodules on imaging, rather than tumors. The renal disease is characterized by progressive parenchymal obliteration by cysts, which commonly leads to flank pain and hematuria, and the condition is not associated with retinal capillary hemangioblastomas. Choice B. Patients with autosomal recessive polycystic kidney disease are typically diagnosed in infancy or childhood. Although the disease is associated with multiple renal cysts, patients characteristically develop end-stage renal disease in early childhood, and hepatobiliary involvements common like hepatic fibrosis and liver cysts. It is not associated with hemangioblastomas. Choice C. Li-Fraumeni Syndrome is an autosomal dominant disorder associated with alterations of the tumor protein p53 gene. It usually results in early onset of malignancies such as sarcomas, breast cancer, and adrenal carcinomas. CNS disease is characterized by gliomas and medulloblastomas, not hemangiomas. Choice D. Neurofibromatosis Type 2 is another autosomal dominant disorder with marked CNS and ophthalmologic features. However, it is more commonly characterized by schwannomas, particularly of the vestibular nerve, and meningiomas. Cataracts and retinal hamartomas are common ophthalmic manifestations. If you still don't understand, click the like button so that we can create more videos on this topic for you.